Some of the most common conditions that patients see us here at Premier Vein for is venous insufficiency, varicose veins. Testing for venous disease mainly involves venous ultrasounds. And by doing venous ultrasounds, we ensure, number one, the absence of any blood clots or deep vein thrombosis. But number two, we study the function or physiology of those veins. If we think about vein disease, veins really do have a very difficult job because they have to take blood from the feet, ankles, and legs up towards the heart. And most of the day, they have to do that against gravity. We're made with one-way valves. Those valves are supposed to open to allow blood to ascend to the heart. And if gravity comes to pull them down, the valves are supposed to seal. But because of a variety of factors, sometimes that doesn't happen very well. And so patients, as the day progresses, especially with venous disease, they tend to become more symptomatic. Whereas in the morning, their legs feel much better. A lot of those patients experience symptoms such as throbbing and aching and cramping. Most of the time, the treatment begins with lifestyle modification, which includes wearing compression stockings, tobacco cessation. If they're morbidly obese, we recommend weight loss, and different lifestyle changes such as if they're resting to elevate their legs, things to try and alleviate their symptoms. If some of the more conservative approaches are not successful in alleviating their pain, then we take an endovascular approach, and that usually means treating the vein with radiofrequency ablation, with sclerotherapy, or with a procedure called Venous Seal. Most procedures that treat superficial vein disease and venous insufficiency are done in an office setting and do not require hospitalization. At Premier Vein Vascular, we treat arterial and venous disease of the lower extremities. If you have any of the symptoms of arterial or venous disease, or if you've been told that you need to see a vascular specialist for arterial or venous disease of the lower extremities, we will give you a comprehensive examination. And if your symptoms are not vascular in nature, we're happy to send you to the right specialist.